Welcome. In this video, we're going to continue the discussion of euthanasia. And we're going to continue that discussion by looking at an essay by Leon Kass called Why Doctors Must Not Kill. So, in this essay, Kass is basically arguing that euthanasia, he'll also argue that assisted suicide by doctors is never morally permitted. So the laws should remain as they are in most states in America, where neither euthanasia nor physician-assisted suicide are legal. Now this is a really interesting essay. It's got a bunch of subtle points and arguably some interesting rhetorical moves. But I'm going to focus in on two important lines of thought that we'll find in Kass's paper. So the first argument we'll call a slippery slope argument. It's a slippery slope argument against legalizing euthanasia, on the basis of the claim that legalized euthanasia would deteriorate the doctor-patient relationship. So that's one important strand of argument in Kass's essay. The other important strand of argument is an argument based on professional duties, where Kass is going to argue that euthanasia is incompatible with the role of a physician. So we're going to have to figure out what is the role of a physician and why can't you euthanize within that role. So let's jump right in. Here is the first worry. Kass thinks that if euthanasia is legal, it will deteriorate the doctor-patient relationship. So when we're talking about the doctor-patient relationship, we're really thinking about all these duties and what we might think of as reasonable expectations between the doctor and the patient. Meaningfully, we can say that it's important for there to be trust between a doctor and a patient, such that any healthy doctor-patient relationship is going to be a situation of trust. So the patient should be able to expect reasonably that the doctor is going to look after their well-being, and the patient is also going to be willing to give the doctor certain kinds of information and maybe even be willing to take certain risks, say like with surgery or certain medications in pursuit of good health. So the doctor-patient relationship is an important thing. If it were to deteriorate, that would be a bad thing. So here's Kass's first line of thought. If euthanasia were legalized, we might be worried about mistrust among patients. There's a passage early in the essay. Imagine you are old, elderly, poor. Euthanasia is legal in this scenario, and you are brought into the hospital with broken ribs and pneumonia. How willing will you be to sleep soundly when you see the nurse adding an extra solution through a needle into your IV drip? Kass seems to suggest, and this might be a rhetorical move, that maybe you won't sleep so soundly in that situation when it's legal for doctors to kill their patients. Moreover, in this legalized euthanasia scenario, Kass is also going to worry that there may be many people whose prognosis is not looking good and where they may encounter pressure from others in order to opt for euthanasia as a hopeless case. And we might think that this mistrust among patients, as well as a general environment of pressure, could deteriorate this trusting relationship. So that's one point. Furthermore, Kass is going to argue that patients who are deeply suffering, so a person who is in the position of asking for euthanasia, he suggests that they are unlikely to be in a good position to offer informed consent to end their life. Here's his line of thought. He's going to say, when you are requesting euthanasia, it's because you're in a great deal of pain. And when you make requests or make statements under duress, that's like under pressure, we shouldn't take what's literally coming out of your mouth at face value. And it seems that Kass's argument here is that a person in enough pain that they want to stop living, well, that is a kind of duress. So this undercuts their ability to offer informed consent to end their life. Moreover, a couple of pages later in the essay, Kass will even argue that it is actually incoherent. We might say it's completely irrational to ask for the benefit of euthanasia. Here's the argument. You can't be made better off by being taken out of existence. In fact, being taken out of existence is never a benefit for a living, breathing human being. So on these grounds, Kass will argue that when a patient asks to be euthanized, well, we must kindly tell them that we cannot do that on the basis of the claim that this is not a rational request that's being made by the patient. Now, within this line of thought, he's also going to argue that once legalized, euthanasia won't remain confined to cases where patients request it. So he says, well, once we allow it for those of sound mind, we might also then extend euthanasia provisions to people who are not yet of sound mind, who are in permanent vegetative states, who are disabled infants, and so forth. And he says that not only is this a worry that he has, but it's a worry that he thinks is backed up by evidence. So he points to a survey. It says that 40% of physicians surveyed in Holland had performed euthanasia without the patient's request, and 10% of these physicians had done this 5 times or more. Now this, at face value, is very troubling, that we have euthanasia being performed not because the patient is requesting it, but for some other reason. Now, one line of response that we might flag for this point, and really questions that we can look more deeply at, would be the question of, well, within these cases where we're performing patients with euthanasia without the patient's request, are we dealing with non-voluntary euthanasia, where we're getting request from a proxy, which some people are morally okay with, versus, for instance, involuntary euthanasia? This would be the situation that is horrifying, the situation where a person is euthanized even though they are asking explicitly not to be euthanized. One tricky thing about Kass's essay, I've read this essay a number of times, and I've done a little digging. I don't know what Kass's source is here. If anybody out there on the internet knows exactly which source we're dealing with here, that would be a worthwhile thing that I'd love for anybody to send back to me. But given that this essay was published in 1991, I think that this is a moment where we should also look for more up-to-date evidence, right? What's going on in the Netherlands now? We could also see what sorts of euthanasia other than voluntary euthanasia is happening in other countries where it's legal, such as in Canada. But at face value, Kass has a worry here that euthanasia might be extended even beyond the model of a competent patient requesting euthanasia. Here's another thing that Kass tells us. This is on page 329 of my version of the essay. He says, a physician friend of mine, somebody who worked in hospice care, explained it to me, as he puts it, most convincingly. Only because I knew that I could not and would not kill my patients was I able to enter most fully and intimately into caring for them as they lay dying. That's significant. So we might say, at least according to some physicians, because we've taken the option of euthanasia off the table, that makes it easier for these healthcare workers to stay with their patients and help them have a dignified, and we might even say courageous, death. Within this context, and this might be the most important part of Kass's worry on the basis of the doctor-patient relationship, is that part of how the doctor-patient relationship functions is by having certain kinds of boundaries. And he says that these boundaries go all the way back to ancient Greece and the Hippocratic Oath. So in the Hippocratic Oath, this is basically a pledge that new doctors would recite after getting their training from Hippocrates. One of the things banned in that oath was provision of life-ending drugs. It bans other things as well. So Kass points out sexual relations with patients and breaches of confidentiality. A small aside, we might notice that there are some other parts of the Hippocratic Oath that might seem strange to our modern eyes. So for instance, the Hippocratic Oath tells physicians that they must never perform surgery. Back in ancient Greece, the people who performed surgery had a role that was more like that of a barber. And physicians only had the role of diagnosing and prescribing. So we might notice that not everything from the Hippocratic Oath is worth following nowadays. And in fact, if you hear the Hippocratic Oath recited at a med school graduation nowadays, it will often be very different from the exact text that Hippocrates was using with his students. So for instance, it removes that ban on surgery that I mentioned. But there's some stuff that remains, right? You shouldn't sleep with your patients. You shouldn't breach your patient's confidentiality. And Kass thinks you shouldn't provide life-ending drugs. Now, we can't just say you can't do these things because the oath says you shouldn't, right? Because there's surgery in there as well. In fact, versions of the oath also ban abortion, but med schools simply remove that from the oath nowadays. So we have to ask the question, why should certain kinds of bans be within the Hippocratic Oath? And I think that Kass has a worthwhile point here. And he says that this is a way of protecting the vulnerability of patients in the doctor-patient relationship, because the doctor-patient relationship is asymmetric. Like a symmetric relationship is one where two people are on a par and their risks and their benefits that they can get from the relationship are pretty much equal. That's why we call it symmetrical, right? The idea is that a doctor-patient relationship is asymmetrical in certain ways. So, sexual relations. Your doctor may need to see you naked, but you don't need to see your doctor naked, right? And in that way, the exposure of yourself makes you more vulnerable to the doctor than the doctor is vulnerable to you. Breaches of confidentiality. You will tell things about your own life to your doctor, necessary for good treatment, but the doctor isn't going to tell you about, who they sleep with or what kinds of drugs they use or how much they drink, right? So there's an asymmetric relationship in confidentiality. And I suppose we could also say a doctor has more ways of ending your life than you have ways of ending the doctor's life. This is why we say, you're literally putting your life in a doctor's hands when you go into surgery. So Kass is going to argue that because there is this vulnerability of patients to their doctors, well, how do we protect against this vulnerability and make sure that patients trust their doctors? Well, what we're going to do is we're going to put up some hard limits, right? Here are some lines the doctor must never cross. And by putting these lines in place, it makes it more comfortable and easier for the patient to trust their doctor, right? So this is the first line of thought that we get from Kass, right? We would deteriorate the doctor-patient relationship, this relationship of trust within the context of vulnerability. That relationship would be compromised if euthanasia were legal. Second line of thought, but before we get to the second line of thought, let's just sum this up. Basically, Kass is giving us a slippery slope argument, right? If legalizing active euthanasia would eventually lead to terrible abuse, then active euthanasia should be illegal. And second, legalizing active euthanasia would eventually lead to terrible abuse and deterioration of trust between doctors and patients. Therefore, it should be illegal, right? So this does seem to be a logically sound argument. If 1 and 2 are true, that is going to guarantee our conclusion 3. Now, sometimes you may have heard slippery slope arguments described as a fallacy. This is not quite true. Some slippery slope arguments are in fact good ones. We're going to talk about this a bit more in our discussion of critical thinking for this course. But what we really need to do here is figure out whether 2 is true, right? So we have to figure out whether there is terrible abuse that emerges in the context of legalizing euthanasia. Now, we actually have countries where euthanasia is legal. So I think that part of what we would do in further investigating the plausibility of Kass's conclusion, it's going to be to look at what's actually going on in countries like Colombia and Spain and Canada and the Netherlands. And some authors, so Peter Singer, one of our other readings for the course, or Dunn and Hope, they're going to suggest that perhaps safeguards can be put in place, right? So perhaps we could write our laws in a certain way such that we won't run the risk of involuntary euthanasia, which will perhaps help a patient to sleep better at night, even in a country where euthanasia is legal. Okay, now we're going to come to the second worry. Here's a passage from Kass. I think that this is probably the most important passage of the whole essay. Here's what Kass tells us. He says, the central meaning of physicianship, that's a mouthful, physicianship, derives not from medicine's powers, but from its goal. Not from its means, that is the technologies, but its end, that is its purpose or its aims. What is that aim? To benefit the sick by the activity of healing. The physician, as physician, serves only the sick. He does not serve the relatives or the hospital or the national debt inflated due to Medicare costs. Thus, he will never sacrifice the well-being of the sick to the convenience or pocketbook or feelings of the relatives or society. I think that that's a great point, right? As a healthcare worker, the main person that you're working for is the patient. And in fact, it's not right for a healthcare worker to refuse care to a patient because you might be worried that it might cost the system too much. In your role as someone's caregiver, it's your job to advocate for them to the extent that you can. When rationing decisions are made, those decisions are going to ultimately be handed down by administrators, not the doctors providing care. All right, jump back in. Moreover, the physician serves the sick not because they have rights or wants or claims, but because they are sick. Right? So the idea here is people get your care, they deserve it because you need healing. It's not because you have rights or claims or wants. The fact that you have rights or claims or wants doesn't automatically entitle you to medical care. So Kass says the healer works with and for those who need to be healed in order to make them whole. So the big point of this passage, what is the job of a doctor? What is the point of their job? Well, their job is healing, right? If healing were impossible, there wouldn't be any point of there being any doctors, Kass thinks. So, why is this important? Well, he's going to say further that you can never heal somebody by giving them euthanasia, right? Think about the idea that you never become more healthy once you die. Even if you're suffering a great deal, Kass thinks, being dead is never being made better off. So Kass is going to say any practice that undercuts the healing role of the physician should be banned from the profession. 2, euthanasia would undercut the physician's healing role, right? The job of a physician is to be a healer. And he's going to say, look, euthanasia inherently is the opposite of healing. It takes you out of existence. You can't be dead and healthy at the same time. It's the job of the healer to make someone more healthy. So, euthanasia should be banned from the medical profession. After all, the medical profession is all about healing. So that's the second prong of Kass's argument. Not even just the consequences, but we need to respect this point about what medicine is for. He's going to say, if we allow euthanasia, we would actually be redefining the purpose of the entire profession. And that would be a mistake, he thinks. Now, we could maybe offer a couple of challenges. One thing we might notice is, well, if the medical profession isn't supposed to perform euthanasia, could some other profession perform euthanasia? If it's only doctors that must not kill, could we, for instance, design a new profession that is licensed to help end a patient's life once they come to a point at which they no longer find it worth living? We would say, look, we'll leave the healing to the physicians, and we will leave some other role, I guess, release from pain, to these other people. We might call them like a death nurse. Now, maybe Kass would say, well, no, only medical professionals get to use needles and certain kinds of drugs. So this argument should be encapsulating not just doctors, but also nurses and physicians' assistants and so forth. But then he'd be saying, basically, that only healers get to use certain kinds of technologies. Maybe he's right, maybe he's wrong, and I'll leave that for you to reflect on. But the other thing that we might say is maybe we could be more expansive in our understanding of physicianship, right? The purpose of physicianship. And we might say, well, part of a physician's role is to heal. But we might realize that there are some situations in which a physician will do something for a patient for purposes other than healing, right? So somebody who works in gerontology, that is medical care distinctly aimed at the elderly, Part of what a gerontologist focuses on is palliative care. And when we're talking about palliative care, I'll get that written out. Palliative care is healthcare that doesn't aim to cure a person of a disease, right? But rather it helps to manage a patient's symptoms. So when a person is coming towards the end of their life, they might be placed under what's called comfort care, for instance, a cancer patient. And when a patient is placed under comfort care, the realization is that we are not going to try to cure this person's cancer. We know that this cancer will kill this person, but within this context, we are going to do what we can to help this patient be comfortable in their last moments of life, right? So we're not trying to treat the disease, but we do try to manage the symptoms. So that's palliative care. And we might notice, for instance, that palliative care is not trying to heal the person. Or maybe Kass would tell us that palliative care is a kind of healing. But then we start to say, well, then we're not just trying to fix problems, but we're also trying to manage symptoms. And why wouldn't we treat euthanasia as one tool in our kit for management of the symptoms of pain? We could also perhaps think of other examples in which we're engaging in worthwhile physicianship, but not trying to heal a person. We might also think about elective surgeries, a surgery that a person doesn't necessarily need to be healthy, but maybe they might receive a surgery because, for instance, a cosmetic surgery might help that person feel more beautiful. And that would be good for their self-esteem, but we're not healing a sickness. Or at least it's hard to claim that we're healing a sickness in that case of an elective cosmetic surgery. So, we've seen two arguments from Kass. I think that perhaps this last line of thought is a question that we should really sit back and reflect on, even if we disagree with Kass, right? I think that this is perhaps one of the most important questions in professional ethics. What is the point of my job? What would the world be missing out on if my job didn't exist? And Kass gives us an answer, maybe one that you disagree with, that the point of the physician's job is to heal. And if you disagree with Kass's point, it would be rather sad to say, well, the physician's job is actually pointless. Instead, we should try to figure out what a different point of our job might be. And once we sort of answer this point of the job question, we can use that as like a guiding point on our compass that can sort of lead us through many of the ethical questions that we might encounter in really any career. So, just to sum up, we saw two important lines of thought. One was a slippery slope argument about the deterioration of the doctor-patient relationship. And then second, we saw this argument about professional duties, where Kass argued that a doctor must never kill because euthanasia is incompatible with the physician's role as a healer. So I'll leave you there to reflect on Kass's argument. Was Kass right or was Kass wrong? I'll leave it up to you to ponder and decide. Thanks for listening, and take care.